My name is Karen Yeung. I'm a professor of law, ethics and informatics at the University of Birmingham, and I'm situated in both the law school here as well as the School of Computer Science. And this project is funded by the Wellcome Trust, and its aim is to explore the opportunities, challenges and risks associated with utilising blockchain in healthcare contexts. So it's very broadly defined, and that's largely because the space is only relatively recently inhabited by blockchain technology. So there's an established set of activities and market in cryptocurrencies. The movement of distributed ledger technologies, which is the more precise term, in healthcare contexts is relatively new. And so our aim is to try and identify what the parameters of the potential promise for these technologies is in the healthcare space, and to identify what might actually have real prospects of providing effective solutions to healthcare problems, and what is really mostly froth and bubble. So one of the challenges associated with modern healthcare is that it's an enormously complex environment with many interacting people, parts, operations, substances, equipment, and so on. And all of these complex interacting parts are generating records, because it's now very easy to generate records through computational systems. And so almost all of this has some kind of interaction with some kind of computational system. So we have a vast store of digital records, but we actually can't access those records in a way that can assure us that we have all of the records that we need that relate, for example, to a particular patient, to a particular group of patients, or a particular set of activities that is of interest to us. And as we know, data is the new oil, but data is not the new oil if it is poor quality oil. So blockchain has the potential to enable us to create and order those records on an unchangeable, secure and highly trustworthy distributed ledger that will enable us to identify and to access all of those records easily in a way that gives us an enormous amount of confidence that we have the right data and a comprehensive data set through which we can then analyse for very many purposes that ultimately, hopefully, will lead to an improvement in the quality of care that we provide to patients at a lower cost. If you think about the potential that blockchain offers, it's really about improving the entire operation of the healthcare system. And ultimately, of course, healthcare systems are about improving the quality of care that we provide to patients. So the hope is, of course, that ultimately blockchain can help improve and make more efficient the quality of healthcare delivery. But of course, in the first instance, the people who will primarily benefit from more streamlined and efficient operations of data management are those who operate in the organizational and clinical space, who have to handle the data on a regular basis. So in the first instance, I imagine that the patients won't experience any direct benefit unless and until, of course, it is possible to give them more fine-grained control over their own patient records, in which case potential for transformative experiences for patients is then possible. But whether or not blockchain can provide this is a very open question, and that's one of the questions that we want to explore in this project. What is the near future? Okay, well, I think it depends very much on which jurisdiction you're in, and our project is concerned with trying to identify what is the state of the art in blockchain for healthcare at this particular point in time. And in fact, that turns out to be quite a difficult question to answer, because there's been so much hype and excitement in the blockchain space that there are a number of so-called white papers that have been promulgated, and firms with very attractive logos that look like they have an extensive blockchain solution already up and running. But actually, once you look under the hood, turns out that it's a little bit like the emperor's new clothes. So one of our challenges is to try and identify what really is going on in this space that has the potential to deliver on the promises that blockchain technologies might in fact offer for healthcare. And if we can really get to the bottom of that, we might be able to identify exactly where the potential benefits of blockchain really do lie. What we hope to be able to identify is, in a much more precise and rigorous way what the genuine opportunities of blockchain technologies, broadly speaking, will in fact be or are likely to be in healthcare contexts. And by that, there are many claims that are made about what this technology could deliver, which sound amazing. But I think once we drill down into the detail, we are likely to find a number of challenges, and they may be legal, they may be technical, they may be organizational, or they may be ethical, which prove insurmountable once we start to think about how we might in fact establish or create the technical architecture of these systems and then implement them in real healthcare contexts. So our hope is that by the end of this project, we might have a much clearer view of where the real opportunities are to deliver benefits to patients and clinicians in the healthcare system, and what is mostly froth, bubble and hype that isn't really going to deliver any real improvements for anybody.